name is Monique, and I am part of the Hudson Valley Paramedic Class of 2019. And today we're going to be reviewing how to do an endotracheal intubation on an unresponsive patient. The first step with an intubation is to identify when and where to use it. You always do intubations on a patient that is unresponsive for one, somebody that has no gag reflex, a patient that, or along with unresponsive, is apneic. Um, So your first step is to have all of your equipment ready. You're going to need a mask, gloves as your BSI equipment. Some agencies will use a gown as well. You're going to need an OPA or oropharyngeal airway in order to keep the patient's mouth open. You're going to need a syringe that is at least up to 10. You'll need a tube that is sized for the patient with a stylet. You'll need a handle. And you'll need your blades. Typical blades are a Miller blade, which is straight, and a Mac blade that is curved. Some agencies will also use digital intubation blades. You'll need a stethoscope to listen for lung sounds and for placement of your tube. An entitled tool also as a confirmation tool for placement. You need to secure your device. You'll need to oxygenate your patient. A typical BVM is fine. And then you'll need an oxygen source for it. Some optional things you can use are an ATV as in lieu of a BVM, and McGill forceps depending on if you need to take something out of the patient's mouth before performing your endotracheal intubation. And you also have your suction tube, your suction unit that you use to suction out any vomit or blood from the patient's mouth.
Step 1. Take standard precautions. Gloves, gown, face shields, whatever you feel you need. Step 2. Measure and inspect the OPA. Insert it into the airway after visually making sure the airway is clear. Step 3. Have your assistant pre-oxygenate the patient for 2 to 3 minutes with a BVM and 100% O2. You want that pulse ox to be above 95%, or at least at it. Step 4. Check and prepare and assemble your equipment for endotracheal intubation. We already covered what equipment you will need, so you should have that all out. After step 4, assembling all your equipment is finished. Step 5 is to place the patient's head in a sniffing position. In pediatric patients, you may need to add towels behind the shoulders. Step 6, remove the OPA and insert the blade into the right side of the patient's mouth with your left hand and displace the tongue to the left. Step 7, gently lift the handle upwards as if you are making a toast or cheers until you can see the glottic opening and the vocal cords. This is called direct laryngoscopy, visualizing the vocal cords. Insert the ET tube through the right corner of the mouth. Step 8. Step 9 is to visualize the entry of the ET tube going between the vocal cords. Step 10. Next, you want to remove the laryngoscope blade from the patient's mouth. Alright. You inflate the distal cuff of the tube with a 10 millimeter syringe. Attach end-tidal CO2 to the ET tube to the monitor. Attach the BVM to the end-tidal CO2 and ventilate the patient. Now you will aspirate the right lung field, left lung field, and then epigastrum. You're going to hear air moving in the right and left lung fields, but not in the epigastrum. Alright, confirm placement of your ET tube by making sure it's at the same number it was when you first put it in. If it hasn't moved, secure your ET device and continue to reassess the patient. And that is how you intubate a patient. Alright. Alright, he's now going to insert it into the trachea. And you will see how easy it is to visualize the cords with it. Oh, wrong side, guys.
You got the esophagus and the trachea.
And voila.
ATV, it's an automatic ventilation device, mostly used for CPR. This button here would offer a ventilation whenever you press it, and it replaces a BVM as it provides continuous oxygen to the patient.
Step 1. Take standard precaution. This includes gloves, face shield, or gown, whatever you may need.
The face shield broke, Junior.
That's alright, you probably won't need it. I don't think these guys any throw up.
There's another one up there.
Do we need it?
No, you don't need it. This is how you use the ATV.
And where Tom's place go? Quick connect to the bottle. Do ventilations every 6 seconds, or whenever you press that button. It squeaks when you get positive pressure on it.
Yes, everyone, the patient is farting.